Welcome back to Common Grounds. I'm your host, Shannon King, here to discuss today what is Kratom, why is it important to Clinton Township, and why I'm proposing that we ban it. Welcome back to Common Grounds. I'm here with our professionals today, Lauren and Elizabeth, and we're going to discuss in further detail what is Kratom and go into why this is important to Clinton Township. Lauren?
I'm Lauren Letzmann. I'm the Project VOX Coordinator for Macomb County through CARE Southeastern Michigan. I am a certified peer recovery coach, a certified peer recovery mentor, and completing my certified prevention specialist certificate. Project VOX is a project in Macomb County, a grassroots advocacy group where we advocate for different legislation, we educate the public on different things related to substance use disorder. We work with our prevention team, and we plan fun events for the community.
Excellent. Thank you, Lauren. Thank you for your important work that you do.
Thank you.
Elizabeth?
Hi, I'm Elizabeth Lucas. I'm a professor of nursing over at Macomb Community College. I am also a psychiatric nurse practitioner with over 26 years of experience in psychiatric nursing and over 34 years of experience as a nurse. So I teach mental health nursing to the nurses in our community that work in the hospitals and clinics in order to maintain health of our community.
Thank you so much for your important work and education that you do of our students and of our greater community. So thank you. Thank you both, actually. Thank you. So as we dive right into it, give me a little bit of understanding for myself, the audience at home, our residents. What is Kratom? Because there's just some people probably have never heard of it. I can guarantee you that. There's other individuals who've seen it in a gas station, they've seen it in a convenience store, they've seen it online, and it might be marketed as a herbal supplement that helps with pain and anxiety. And there's other folks that are using it as a stimulant to maybe be bright-eyed and bushy-tailed and study. And there's other folks who are trying to use it just for its euphoric effects, depending upon how much you take of it, which obviously is dangerous. So if you could just talk to us in greater detail and really kind of inform us what it is, really appreciate that.
Okay. It actually is marketed as a dietary supplement in the United States. And it is actually a leaf off of a tree that grows in Southeast Asia. So it's imported from China into this country. And yes, it is used as a pain relief. It's used as a stimulant, and it depends on what the dose is as to what the effects are. But ultimately what it does is it produces a sense of euphoria, a sense of relief, and it deadens pain, how our brain perceives pain. So that's why it's being used in that way. But in low doses, it does help people feel more stimulated, and in higher doses, it has more of the sedating and pain relief effects.
And on the recovery side of things, people with opioid use disorder sometimes turn to that to manage their withdrawal symptoms. But there are other FDA-approved medications that could also do that.
Yep. Yeah, and it does hit the same receptors in the brain as prescription pain medications, and also things like heroin and fentanyl, same centers in the brain.
So I think that's key. I want to be able to just pause for just a brief moment, because I think they both hit on something that's very important, is that one, there is existing federally regulated drugs that help maintain with some of the issues that are out there that currently exist. So Kratom, from that perspective, not being regulated, brings some things into question. And then two, it's dealing in the exact same receptors that opioids do, correct? So it's interacting and it's being able to change your mood, be able to hit that nervous system in a way, dopamine, if you would, right?
Correct,
Those
yes.
dopamine centers that is hitting your brain and how it reacts, and that can be dangerous for so many different reasons. For so many different reasons. You touched. We talked about it a little bit at the very beginning. You both kind of hit on this. People are using it for different reasons. Could you give me an understanding of why a student would want to utilize this?
A student might want to utilize it in order for the stimulating effects so they are able to pay attention. It also could be that they suffer from pain because we are not a very well society. We have more younger people with chronic illnesses all the time, and we have limits to how much pain medication really is recommended to be prescribed. So if that runs out, people are going to look at other means. And the fact that this is a dietary supplement means that it doesn't require a prescription, that it is freely available, and that it is not regulated. Our FDA has guidelines, not strict laws as to how this is manufactured and monitored. You really honestly don't know what's in it.
And some would argue that we're students for our whole life, but in particular, our younger individuals, our younger residents are those students that we typically identify with, our youth. Could you talk a little bit about what you've seen with our youth and the use of Kratom?
So a lot of our coalitions that our agency provides technical assistance to, they do environmental scans. So they go around and they see what is a smoke shop selling, what is a gas station or a convenience store selling, in addition to nicotine, alcohol, those things. And so we're able to see how prevalent it is in the community. And since there's no age restrictions on it, youth can turn to that and they can help alter their mood, in whichever way they're looking to do, and whatever dose, so to speak, works for them. But we are also seeing the harmful effects of it. And we really want healthy, safe communities. And with that, any type of regulation or testing or age restrictions would help create healthier communities.
Yes, yes. So we've seen our youth, utilizing this. We understand that it's not regulated. There's no age restrictions here in Michigan. So anyone at any given moment in time, without parental assistance, without guardian assistance, can go and utilize this. And in some instances, it's actually marketed to children because, or to youth, I should say, because of its effects and what it can do, whether it be because it's a stimulant or whether because it can have those euphoric effects. It also can be utilized by different populations besides that as well. So we've seen our elderly population get wrapped into this as well. Could you expound a little bit on why maybe our elderly could be getting involved with this?
Well, as we have more restrictions on how much pain medication is out there, we have fewer options as to what we have available. So not only are doses getting smaller, but the amount of doses we're allowed to give is smaller, and the types of medication get constricted as well. So people were in the past reaching for heroin, actually, and it very easy to find in nursing homes and in assisted living, and much to everyone's surprise. But this doesn't have that stigma to it, and it has easier availability, and it also is cheaper, to be quite honest with you. The problem comes in that you can very easily become addicted to it. You can go through withdrawal, and you can overdose. And it, because it hits those same receptors in the brain as fentanyl does, it's very hard to tell when someone overdoses unless you test for it specifically. You have no idea whether it's fentanyl or kratom, to be quite honest.
So there's a lot of uncharted territory here that we have because this is an unregulated drug, because it's not tested. There's so much of our population that could get really caught up in this, and because it has those same receptors, again, as opioids does, it poses a health risk, I believe, to individuals out there that we need to be very, very mindful of. Could we talk a little bit about, just to bring everybody into full circle about what we're dealing with here and why this is important, is that I talked a little bit about, gave the little teaser about I want to ban, I'm putting together an ordinance and want this banned within Clinton Township. Could you give me some insight to what other communities have done? Again, this is not banned here in Michigan, it's not regulated, but other states, other cities, other counties have taken steps to deal with this because it is an important piece. So I want to speak to you, the audience, and make sure you understand where I'm coming from, and want to be able to refer to our professionals who can talk a little bit in greater detail about what the greater United States has done about this.
Well, there are a number of states that have banned Kratom altogether, including the District of Columbia. There are also other states who have regulated Kratom, so only people over the age of usually 21 could purchase it. They offer testing on the purities in terms of regulation in that sense, and also looking at the dosing with it. Because when you talk about an herbal supplement, it sounds natural. It sounds, like
harmless.
Yes, harmless, and similar to cannabis use. And I think people don't understand the dangers of it because it is so readily available, and there's clearly a demand for it because it is so readily available, not only in Clinton Township, but in other communities around Macomb County.
I appreciate that. I think that's just very important for us to be able to remember that we're dealing with a substance that is coming from far away. It's not regulated. We don't understand what's in it, the purities that it could be packaged, the impurities, I should say, that it's packaged with, whether it be, I've seen information that has like salmonella outbreaks. I've seen toxicity or lead components that get mixed, or metals that are intermixed with this. So there's just a lot of things that, and not to mention, we also don't have a prescribed dosage. What is the right amount that we should be taking for our right issues or our circumstances of why we're taking it? So this really poses a lot of challenges, and this also could find its way into, you touched on this earlier, Elizabeth, where you talked a little bit about how there's no testing for it in particular because it's not regulated here.
Correct.
So our, I'm just thinking, right? If I'm a person, I have an issue, I want to be able to continue to have the effects of an opioid, but don't want to test for it. Is this a go-around for some individuals potentially? Or?
Yes, we've seen it in certain professions where being able to say that you have nothing in your system is extremely important. That they will use this substance because it is not regularly tested for. It's not even regularly tested for during an OD even. Most of the time when we do see it as blood levels are either when we really are suspicious of something, or it's on autopsy, unfortunately.
So with these things being said, I think it's extremely important as a trustee here in Clinton Township, but more importantly as a friend, a neighbor, a resident who lives here as well, that we ban Kratom usage, and that we look to be a leader here within southeastern Michigan and a leader here within the state, and speak out on how this is a harm right now to our citizens, to our residents. It's plaguing different populations, of Clinton Township, and I think it's important for us to think about who we are and how we as as your township, helps protect and helps, take away harm from our residents. And so I want to make sure that we're working hard to help protect our community, help protect our children, help protect our elderly, and help protect everyone. And so by banning and by putting this ordinance in place, I think we're going to be moving towards being able to provide a safer, better, thriving Clinton Township, and hopefully a township that can serve as a model for our surrounding townships and cities around us. That being said, thank you so much for being a part of this episode of Common Grounds, where we discuss Kratom and why I think it's important that we ban it here in Clinton Township.